All right, welcome back, beautiful people. This is your podcast at Forever Young. I'm Dr. Layke.
And I'm Dr. Payman Danielpour.
And today we will be talking about the Mommy Makeover.
Our favorite procedure ever.
We'll at least talk about preventative measures, how to avoid it if you can. Sometimes it's not possible. We'll talk about who's a candidate and timing. We'll talk about what a Mommy Makeover actually entails. We'll talk about some of the pitfalls, and then we'll kind of give you some pro tips at the end and discuss why we think ours are better than the average out there.
But I think what we should start with is something that people always want to know. Why does something happen, right? So what does pregnancy do to a woman's body that makes them need any procedure whatsoever? Why does it happen to one person and it doesn't happen to the other? What can you possibly do to prevent the need to come see the two of us? So we'll start out with just regular pregnancy and what happens, and we'll start out with the breasts and then we'll go to the body, because the Mommy Makeover really talks about doing a procedure for the breast and the body. So we know that when you get pregnant, the breasts get engorged, they get much larger. And the reason they do is because there's milk production. Problem with that is sometimes they get so big that not only do they cause excess skin, but they cause stretch marks, and they make the breasts sag. Now,
stretch marks, which are the bane of our existence, the skin has really two main layers. There's the epidermis, which is the outer layer, and there's the dermis, which is the important part. That's the thicker internal layer. And stretch marks are actually tears in the dermis, the internal layer. But the epidermis stays intact. That's why sometimes they look translucent or purple, because you see little capillaries through there, and they can look pretty awful. And so you have to imagine that when the breasts become larger and they fall, and then when you get tears in the dermis, it's like losing the reins of the horse. You just let everything go, and the skin can no longer hold that kind of weight. And it does create some massive issues for many women.
And the difficult part is, and people don't get this, and this is why we're in business and there's so many plastic surgeons, is our biggest problem is we live on the planet Earth and there's gravity. And if there was no gravity, then none of the stuff would matter.
Gravity gets us all.
So gravity gets us all. And the larger something is,
faster
it falls. So breasts, start with that. What's the most common thing we see is breasts that are sagging, or what we call breastosis.
Afterwards, the plummet or reduction in progesterone and estrogen cause everything to return. The object is for your body to recoil and return back to normal. Doesn't always happen. And so I can just give a couple tips as far as keeping yourself in shape to the day you deliver. It will give you the best potential post-pregnancy body outcome, because the muscles themselves are kind of holding things into place. Once you allow the fascia, which is the connective tissue over the musculature, to stretch, there's only a certain percent that will recoil or return back to normal. If you think about it, we lose 1% collagen elastin after age 20 per year. And so the older you have a pregnancy as well, it's harder to recoil just because you've lost that elastin. Listen, in a perfect world, we have our babies early and body recoils and returns back to normal. Not always the case.
But it's interesting. The old adage of and everyone asks us this when they have surgery, should I come into surgery in the best shape possible? Well, obviously. And that's what John's just saying. So if you can have your baby and be at the same, in really, really good shape, then the chances of you having post-pregnancy changes that are very dramatic are not as high. Now, sometimes it does happen, and there are other factors as well. Now, depending on the number of pregnancies matter a lot, because people come and they say, my first one, everything was fine. The second one was fine too, and then the third one, just everything fell apart. It's interesting I say all this stuff, because then there are zebras out there, like Dr. Layke's wife, who has had twins and another child, and she looks amazing. Why is that? Well, genetically, she's blessed. She's taller. She's got a longer torso. But most of all, she worked hard before and after.
Yeah, she exercised up until, I'll never forget, it was the day before she was doing HIIT training with twins, the day before she underwent a delivery.
The post-pregnancy changes will not be as dramatic. The one thing that most OBs will tell their patients is, you don't have to overeat because you're pregnant. You don't have to put on a significant amount of weight. 20 to 30 pounds, I guess, is plenty. Some people come in here and they say they gained 80 pounds in their pregnancy. Well, obviously, it's going to change your body. It's going to make a huge difference. And I think that's one of those things that the pregnancy itself is important for you to keep yourself in shape.
Yeah, we're giving you goals. The idea is anything, like Dr. Danielpour said, beyond 15 to 25 pounds in excess of that tends to wreak havoc on the body. The other thing that he alluded to earlier was to keep yourself moisturized. I mean, the idea is you want to maintain healthy hydration of the skin. We look at some of these post-pregnancy changes. The idea is, will you develop cellulite during pregnancy? Of course. Are you going to develop what we call lipodystrophy, which is the accumulation of fat in areas that you just don't want it? The reason for that is because you are essentially holding on to nutrients for the baby. And
but it depends the extent, right?
Definitely. Remember, most of the time you're feeding one baby, not three. And if you do have multiple pregnancies, obviously you're going to gain a little bit more weight.
Now, when people come in to see us, it's most of the time for Mommy Makeover, it's both breast and body. Now, we're going to go back to the body again. And again, one of the most common complaints is they'll turn around and they say, look at me from the side. I have a bulge. And that bulge is something called a rectus diastasis. It's simple, and that's in layman's terms, is basically the muscles, which are the rectus muscles, normally are put together. They're together, but what happens is they separate. That fascial layer in the middle gets thin because we need to accommodate for a child. Now, again, depending on how good a shape you're in, depending on how large the baby is, depending how genetically you are gifted or not, all of those things play a part, and that's how we see the recoil at the end. Now, some people have multiple pregnancies and don't have much of a diastasis, and if they don't, we have a simple solution or a simple treatment that can help it. But most people come in and there's a relatively large diastasis, and then it goes above the belly button and below. Now, the belly button itself also sometimes pops out, so that innie becomes an outie after pregnancies. And that's sometimes called an umbilical hernia, where there's a tiny little opening in the fascia, which is very common in a pregnancy.
Yeah, some people are just born with it and then just accentuated with pregnancy. And the idea is, can it convert from an innie to outie? Yes. Can you be born with it and it just gets bigger? Yes. So these are all things that we can touch on, as we go on here, on ways to correct them. The really important thing now would be to talk about, well, when should I undergo some form of a mommy makeover?
Honestly, we like to say, depending on when you stopped breastfeeding. So if you breastfed, the least amount of time we'd make people wait is 6 months. Ideally, I'd like to wait a year.
And we're assuming that you are not going to have more children, because the idea is if you are planning on having more children, some people say, well, look, maybe I'm not having children for 5 years. If that's the case, then, you can undergo any of these treatments, but know that pregnancy is going to do the exact same thing all over again and ruin your results. So if you can hold out, wait, and then it's fixed at the end.
Very true. I would wait till all your pregnancies are done and then see what your goal is. And really, personally, I would love patients to wait a year. Some people don't want to wait a year, so I say 6 months after you're done breastfeeding. And the reason for that is we want to make sure we are seeing basically all of the post-pregnancy changes take into effect, and we don't still have milk production. Breasts aren't bigger than they're going to be. We want to see how everything is going to fall, so then we can fix it, and we're not going to chase things that are going to change again later.
Yeah, the milk ducts will involute and shrink, and that process again is going to take 6 months or more. So that would be the minimum. So if we had to talk about timing, obviously 6 months, a year would be ideal.
Some people come in and they say my breasts are deflated. Probably the most common complaint after pregnancy. My breasts feel like they're just skin. They have no tissue. I had the best breasts. What do I do? That's where we kind of can say you have three options. One option, do what's called an augmentation mastopexy. So breast augmentation, which is putting an implant in and then doing a breast lift, removing skin so we can tighten the breast envelope and make the breast look like a very youthful breast with fullness. Again, our aesthetic is to go smaller so you have longer lasting results, because the bigger you go, the faster it falls.
And this is all depending on how much extra skin you have. I mean, the idea is the perfect scenario is that you really had no breasts in the beginning. They became engorged during pregnancy. Now you have small breasts again with a little bit of excess skin. You place an implant and it can look phenomenal. But as the skin sags, and again, we talk back about those stretch marks and things like that, the idea is you need volume and skin reduction. And so that's where that augmentation mastopexy comes into play.
And John, that's perfect, because there's some people that come in here and they don't need a lift. They just have no volume, and putting an implant in does the trick, and it looks really natural. I did a couple weeks ago on a girl who had 3 kids. I put a 190cc implant in. It's tiny. It looks like a little chicken cutlet. And she's psyched. She's so happy because she didn't want anyone to know she had anything done, but she wanted a little more fullness. And that's the beauty of what we do for a living. We're not here to completely change you, just make you have your confidence back. Moving along, if you wanted to do a breast lift and don't have volume but don't want an implant, and there are 2 options there. What we can do is called breast lift with an auto augmentation, using your own breast tissue, rearranging it, giving you a little more fullness, plus or minus fat transfer. And we will talk about a lot of different uses of fat in plastic surgery, but today we're going to talk about it in the breast. I would say about a little bit less than 10 years ago, the Plastic Surgery Society and the FDA and everyone came together and said injecting fat into the breast is safe. We can radiologically detect the difference between cancer and fat cells. So now we're using fat in the breast all the time for volume, and it works really nicely. So people that don't want a foreign body in their breast, we can just give you a little more volume because we're doing lipo anyways for most of the time. We'll take the fat, we'll harvest it, purify it, and inject it into the breast strategically to give it enough volume, and then do a lift over the top. Mm-hmm. Those are the real kind of like 3 big types of procedures for the breast. One last thing, and you hit on it earlier, is nipple reduction. Mm-hmm. And sometimes the nipples get really long. And it's a simple procedure. We use the top hat technique. You can literally do it under local anesthesia if that's all that you're worried about, but you can make the length of your nipple smaller. You can also make the width of your areola, which is the pigment around your nipple, all of that smaller as well. That always happens with a breast lift or a breast reduction as well.
Mm-hmm. And I think it's important that you alluded to earlier that you said that the idea is to go a more conservative size because, again, we talked about the stretch marks, the loss of elastin in the skin. The larger the breasts are, we know that they're going to fall faster. So the whole idea for us is we want something to look natural, but also have some longevity out of it. In this particular practice, that's what we choose. And so we'll kind of recap at the end and why we think that our results are better than most. And I think that plays a part. Although breasts are extremely complex and what can be done to remedy whatever problem that exists, but I think the body poses even more of an issue because there are really 3 things at play, or I should say 4 things. 1, we talked about the rectus diastasis, and that's the spread. There's nothing you can do outside of a surgical procedure unless it's a smaller one, and then we can touch on that. There is fat accumulation, there is excess skin, and then we look at the quality of the skin. And so the idea is we have newer technologies that can help improve the quality of the skin, but I think maybe what we can do is kind of go from a person who's got minimal rectus diastasis with minimal skin elasticity loss, minimal lipodystrophy or fat accumulation. And what would be your go-to?
It's great. It's you can always give people, like you always do, good, better, or best. And you can tell people, hey, listen, I can put you a non-invasive machine called M-Sculpt that will build muscle and actually decrease the size of the diastasis by doing these treatments. It uses electromagnetic energy to build muscle, which, again, if you build some muscle, that gap in between your muscles or the diastasis will become smaller. So if it's small enough and something non-invasive can work, that's one option.
It's great technology by BTL, the M-Sculpt. It's high fem technology, high intensity focused electromagnetic energy. And ultimately, they're supramaximal contractions. That means you wouldn't even be able at your best day to contract as hard as this machine will. And it's also 20,000 times in 30 minutes. And so it builds 25% muscle, burns 30% fat, and also has a radiofrequency component that tightens the skin. So this sounds too good to be true, but this is technology that works.
And it's something that we tell patients that have had a baby, 6 weeks after you've had the baby, come do it. Mm-hmm. There is no harm in doing this procedure. The only thing it can do is it can help you get back to your pre-pregnancy body. Mm-hmm. Now, that's for those people that are lucky enough where they don't have extra skin, they don't have a big diastasis, and they don't have a lot of fat accumulation in other areas.
And then one other important stat from that was that there's an 11% reduction in the rectus diastasis. So if you have a smaller one, this is an option that you can use. a step prior to looking into any surgical procedure. So let's say now you've got the medium-sized individual, slightly larger rectus diastasis, a little more fat pockets, that are on the outer thighs or saddlebag area, things like that. And again, you talk about good, better, and best.
Good would be, again, using non-invasives. Now, cool sculpting, great non-invasive way to reduce fat. If somebody doesn't want to have surgery, you can't make them have surgery. If somebody is scared of going under the knife, even though we can talk to them and tell them it's very safe, and people do it all the time, we're not here to make anyone do anything, and we have alternative approaches to making people feel and look better. Now, cool sculpting is great because one treatment can give you about 30% reduction of fat in the treated area. So if you have distinct pockets of fat, like you said, in the saddlebags, you could treat it with cool sculpting, and it'll do a really nice job of bringing that down. You may need 2 treatments, but it's got no downtime. It's done in an office, and you walk right out. Amazing. Really, really great thing. We've had it since the inception. Now we have the brand new cool sculpting machines. We have 4 different paddles. You can treat 4 areas at the same time. And this is a really easy way for a mommy that said, oh my God, I just had a baby 6 months ago or a year ago. I can't go under the knife. Okay, so do this to make yourself better. Combine it with the M-Sculpt, and you'll get 2-for-1 special, and you'll get a really decent result.
Definitely.
But if you want the best, then tummy tuck with liposuction. And we're going to get into the tummy tuck procedure and kind of talk to you and dispel all of the fear that's out there. Because a lot of people that come in here say, oh my God, my friend had a tummy tuck and had to use a walker for weeks. Oh my God, my friend had a tummy tuck and was in the hospital for weeks. Some of the stories I hear, there was a lady that came in from London and we revised her tummy tuck. She told me that they kept her in a hospital for 2 weeks. Our tummy tucks walk out of here. They come see us the following week. We don't use drains. We do things a little differently. We're going to go down how we do it differently.
And this, I think, is where it starts getting complex, because the idea behind tailoring a procedure, a particular set of procedures for an individual, varies so widely. But how do you, outside of liposuction, what's your thought process on trying to improve the appearance of cellulite?
So it's the $1 million question, $1 billion question. Cellulite treatments have notoriously failed over the years. And every year there is another holy grail that's going to fix it. Here, you got to use this, and there's this new one called Quo. That's the collagenase that basically you inject something and it's supposed to break up the fibrous bands. I find it to be a big challenge. I think surgically, if you break it up in fat transfer, it helps. We have something called Body FX, which is a radiofrequency type treatment that really helps. Every single time I've used it on someone, they've been very happy. And my gauge on how well we've done with anything is how happy the patient is. So I believe in Body FX. I think it works really nicely for cellulite, and it's a good adjunct for some of these procedures we do for people.
Sure. And so for those of you who are listening who just want non-invasive procedures, the goal from top to bottom, including breasts, stretch marks, everything else, would be some type of microneedling with radiofrequency. We happen to use the Morpheus. That alone can help improve the quality of the skin, get some skin tightening. The second thing is for fat reduction. You can use a combination of cool sculpting and M-Sculpt, which obviously will help increase the physique. Now M-Sculpt is also approved for inner and outer thighs, buttocks. We also have it for the arms, all kinds of things. And then lastly, the Body FX, which is a non-invasive radiofrequency type machine that reduces cellulite. So it reduces a little bit of that fat volume, uses radiofrequency to heat up the skin and tighten it, and so it improves the quality of the skin. From a surgical standpoint, the full gamut would be that we are doing, let's say, an augmentation mastopexy with, you're using an implant with a lift plus radiofrequency to improve the quality of the skin. So that's where we use Morpheus. And then for the abdomen, you'd likely do an abdominoplasty with full 360-degree body liposuction. And sometimes we even fat transfer it into the butt just to give that little firmness. And so you've got both ends of the spectrum, from fully non-invasive to fully invasive.
And it's interesting because, you guys probably want to know how often we do this stuff. And if I turn over and just take a look at our schedule, I think tomorrow and Friday, I think we have 2 Mommy Makeovers Thursday, 2 Mommy Makeovers Friday. And those are the cases that we do together. Because imagine, me doing it by myself, it would take me, let's say, I'm just going to throw a number out, 7 hours. We do it together, it takes 5 hours. It's a huge difference for a patient. their recovery, anesthetic time, just an overall better way to go about tackling a very large procedure.
Let alone the fact that if I was doing it by myself, you get tired. There's no doubt. Any plastic
Especially
surgeon,
two of them.
if any plastic surgeon tells you otherwise is lying. Because at the end of the games, sometimes when you're by yourself, you cut your losses. When you got someone else watching your work and making sure that you're doing the best you possibly can, and you're constantly checking each other's work, and it's interesting because we do that continuously, where we'll feel the thickness of the skin, and we'll look at, after we've performed liposuction, and say, oh, you missed a spot over there. And so, whereas normally by yourself, honestly, you'd probably walk away and say, oh, don't worry, it'll settle out. And so I think that's a huge benefit in our practice.
And it really makes us leave our egos at the door. Because again, we want to give the person that's on the table the best result. Now, interestingly enough, people ask me all the time, so what does it mean? You do one breast, he does the other? No, it's not like that. When it comes to the breasts, I'll normally get them ready to go. But when it comes to closing the incisions and doing everything else, we do them together. And we make sure they're exactly the same.
The funny part is that you have to imagine, even in residency, the attending would do the right breast, the resident would do the left breast. And the whole idea is two breasts are completely separate. The idea is we're making sisters, not twins. Now, the goal for us in practice is to make them perfectly identical, but sometimes it's not possible. The idea is to get it to close enough where no one else can tell. And for us, even if one does one breast, one does the other, we're continually switching sides and tailoring and doing whatever we need to kind of make sure that we are as symmetric as possible.
People ask also all the time, number one, what's my downtime? How painful is this going to be? Do I need help? What's going to happen to my kids? So kind of take you through, and I'll start with the breasts, and I'll throw the belly at you, just kind of to go from there. 95% of the breast procedures that we do, people really don't have pain. Tylenol does the trick. They're very comfortable with Tylenol postoperatively. They don't take narcotics. Again, if you're doing a tasteful type of breast augmentation where the implant's not too big, there's not too much pressure for the patient, it's relatively simple. Breast reduction surgery or breast lift alone without an implant, those are a piece of cake in the sense that patients have very little pain. Now, the downtime is no heavy lifting, no exercise, and no swimming for 6 weeks. And that's a hard and fast rule that we keep for all of our surgical procedures, except for liposuction alone. Liposuction alone, they can get back to activities as early as they want. However, breast lift, breast reduction, because we have so many incisions and we want to have everything healed perfectly, we really keep you, restricted from all activities for 6 weeks. We'll treat the scars for you. We see you on a regular basis to make sure everything is healing well. And at 6 weeks, then you can do it all.
And that's based in research. I mean, the idea is it takes 6 to 8 weeks for that incision to become technically as strong as it's ever going to be. And so the idea is we want to give it its maximal opportunity to heal before you start doing anything that can destroy it.
Absolutely. And then when it comes to the abdomen, and then the abdominoplasty procedure, which is also called a tummy tuck, it's one of these very feared procedures because people look at it like, oh my God, look what I'm having done. And if you look at social media, a lot of people post these videos of the diastasis repair. And for someone who's not a doctor, it's a little gruesome. And people feel like, oh my God, you're going to open me up and just tie me up. So what do we do to make people not need narcotics, make people very comfortable, have them walk and straighten as fast as possible? And why is it that we have patients that are fine and others don't?
Well, listen, I mean, it all depends on a person's level of pain tolerance, because we do have some patients that will require pain medicine just because that they've always done that. They skin their knee and they need to be in bed for a day, and not to be facetious, but everyone is different. I would say tissue handling is the most important thing in plastic surgery. And the more gentle you are with the tissue and the more you respect every single layer, you'll have faster patient recovery. For us, you have to imagine, we keep talking about sewing up this rectus diastasis like an internal corset. If I take a big needle and I include not only the connective tissue, but a bunch of the muscle as well, you're going to be in pain. And that's going to be for a long period of time because these are permanent stitches that go into that area. So for us, if I can just take that top layer of connective tissue called fascia and bring that together, most patients are pretty comfortable. The second thing that we do is we inject something called Exparel. Now, this is a long-acting Marcaine, which is a long-acting anesthetic that lasts for 72 hours. That's 3 days where you feel pretty comfortable and numb. Now, the majority of the pain is within the first 2 to 3 days. So by the time someone does start feeling a little ache, it's easier for them to just take some Tylenol and go from there. The other thing we do, we're starting to rely less on narcotics and more on the Tylenols and Neurontin, which is a neuropathic pain medicine, things like that, little cocktails that trick the body into thinking that it's not in pain. Whereas a ton of narcotics end up making you constipated. Some people just feel nauseous and lousy. And so we're slowly kind of veering away from those particular medicines. It doesn't mean that you will not have them. It just means that we stress the importance of not using them if it's not necessary. And so I think the combination of those two things really helps. The third thing is that most people dislike drains, these little plastic or rubber tubes that come out of the body and they get snagged on things and they're uncomfortable. So we tend not to use drains unless we truly have to. Someone that, who's morbidly obese, we're doing a ton of liposuction, there are certain indications for it. But at the same time, if we can eliminate the use of drains, I think patients are so much more comfortable.
And I think, nowadays, 85% of our tummy tucks are all drainless. And patients are really comfortable now. Yes, do we put some stuff for you to do at home too? We do. We wrap you up like a mummy. We keep you in a compression garment because we really want that swelling to come down as fast as possible. We'll have you do some post-liposuction massages to get, which is also called a lymphatic massage, to really get your swelling to come down. There are a couple things we do after surgery. Now, all of these things tend to set us apart because it's not just one approach. We want to have a bunch of different things so your surgery is better than it can possibly be. So we can do all of these different things for you. And then on top of it, we'll continually evaluate you. So first week you'll come in, we'll take a look, and then at 6 weeks, we'll let you exercise and start you with M-Sculpt. And then anywhere between 9 and 12 months after, we'll reevaluate your scars. If your scars don't look good, let's say they have extra pigment, which is color, or they're raised, or they're widened, we have multiple different types of treatments for it. From using a laser to take out pigment, to using microneedling to flatten a scar, or injecting the scar, or even revising the scar. So, we really take pride in every procedure that we do, and we will do everything in our power to give you the best result possible.
So thinking of these, now that we've kind of laid out who's a candidate, what a Mommy Makeover entails, what are the different options, we have to look at some of the pitfalls. What should you expect? And so the idea is, if any of these things happen, you want to make sure your plastic surgeon knows about them. Listen, we're not going to go through the entire litany of potential problems, because for our consents to list out some of the things that occur 0.01% of the time, I think sometimes it just ends up scaring a patient. So maybe we just focus on some of the most common things. And I think you touched on one already, which is scarring. And so for us, it's not that we're downplaying a scar, but we know that we have options to always improve the quality of a scar. It's very rare that someone just has a genetic predisposition that does not like incisions, and their body just heals accordingly. And even then, we can make it look better. One thing we didn't touch on was the fact that we use the Embrace Scar Therapy, which is the only post-procedure scar regimen that actually has level 1A data. I mean, this is something that shows that however you heal, this will make you heal better. It's a pre-stretched silicone sheet that goes onto the wounds once every 10 days for 60 days. And I think that's another great adjunct. But if we had to go back to, besides scarring, what's a very common potential pitfall or complication from, Mommy Makeover?
The most common complication of a tummy tuck is having a little fluid left over, and which is called a seroma. Simple thing, if you talk to enough plastic surgeons, they've seen enough seromas for their lifetime. What we do is lift up a very large flap. We take a bunch of extra skin, and your body always wants to fill a potential space that's created with fluid.
Kind of like when you skin your knee and that little yellowish fluid comes out. It's the same thing.
Very similar. And most of the time, your body will absorb up to 30 cc's of this. But if there's a little bit more, after surgery, we can just simply put a small needle in, draw it out in the office, and take it away. Now, is that a big complication? It's not a big complication, but it's a little bit of an extra procedure that needs to be done. It happens a little more frequently sometimes than people would want to see, but it happens across the board and it doesn't affect your final outcome. That's the beauty of it. Otherwise, there can be a little more fat taken out of one area than the other, which you can always do a little touch up for. But most of the time, you can always have bleeding or infection. And I will say in our practice, infection is very, very rare. We do treat people in surgery with antibiotics and after surgery with antibiotics. But generally speaking, with Mommy Makeovers, the scarring is the big concern of people, and we do everything in our power to make it better. We also use the advanced scar therapy gel made by Beverly Hills MD for all of our patients. And it's a silicone-based scar cream that works very well. And it's something we have people put on once in the morning, once at night, and it really helps with the appearance of the scar over time.
And as far as breasts, I think, there are obviously inherent complications from placing a foreign body like an implant. We've heard of capsular contracture, which is scarring around the implant. And as far as fat transfer to the breast, sometimes you lose the fat. I mean, we overinflate because we know that the body isn't going to incorporate all of it. But these are all, as far as potential pitfalls, I think these are relatively safe procedures where people are comfortable or should be comfortable. And so it's definitely not something that you should be afraid of.
And if you ask me, this is by far my favorite procedure because you're dealing with mommies. So they're not coming in because they think that their nose needs to be 2 more millimeters up, or that, it's these people really want to just get back to what they look like before. And for all the mommies out there, I understand what you're thinking. I understand your pain and your frustration, and that's why we do what we do. And in one of the niche parts of our practice is Mommy Makeovers, because we can get you in and out. You don't have to have multiple procedures. You don't have to go see multiple different doctors. And it's something we're so comfortable doing that, like I said, we're doing 2 on Thursday, 2 on Friday. And it really allows people to gain their confidence back after having pregnancies. It's one of the biggest complaints we see as plastic surgeons. And I love it because, again, in my opinion, it's kind of like a reconstructive procedure because you're putting everything back to where it was before pregnancy.
Restoring. Yeah, I mean, kids, listen, they suck the life out of you in more ways than one. And so the idea is for us to be able to rebuild and let you start afresh.
For some people, they don't need to have both breast and body. For some people, they may just have a problem with their belly, or they may just have a problem with their breast. These procedures can be exclusively done by themselves. But the whole Mommy Makeover normally talks about doing something for the breast and the body, maybe a little bit of lipo contouring. If there's any other questions, obviously, you know how to send your questions to us. We'll be happy to answer them for you. But I do think that if it's something that you are really interested in, a Mommy Makeover will give you that pre-pregnancy body back.
If you like this video, you're going to love this one.
If I come to you to have work done, I'm going to trust you. I picked you. I'm going to trust that you're going to put the right amount of filler in, or you're going to pull my nose up just the right amount. But if it's not like that, you can't blame the patient. Because even if I ask you to put more filler in my lips, you're going to be like, okay, that's enough.